How long is recovery from a lung cancer biopsy? Getting a lung biopsy can feel a bit overwhelming, but knowing what to expect can make the process easier. Recovery time really depends on the type of biopsy you have and your overall health. For less invasive procedures like needle biopsies, most people can expect to rest for a few days. You might feel soreness at the biopsy site and some chest discomfort, especially when taking deep breaths. These symptoms usually improve within a few days. It's important to avoid heavy lifting and strenuous activities for about a week to reduce the risk of bleeding or other complications. Most people can gradually return to normal activities after this period, but it's best to follow your doctor's specific advice. Usually, a chest X-ray is done a few hours after the procedure to check for issues like a collapsed lung, which is a rare but possible complication. If a surgical biopsy, such as a video-assisted thoracoscopic surgery, is performed, recovery tends to take longer. These procedures are more invasive, so patients often need about 2 weeks or more to heal. During this time, it's recommended to avoid lifting anything heavier than 10 pounds for the first 2 weeks. Light activities like walking and gentle housework are encouraged early on, but it's important to listen to your body and rest when needed. You can often start driving, going back to work, or doing light outings after 1 to 2 weeks, but full recovery might take longer depending on your individual situation. After either type of biopsy, you may need to stay in the hospital overnight if sedation or general anesthesia was used. If only local anesthesia was administered, you might be able to go home within a few hours once your vital signs are stable. Having someone to drive you home is important because of the effects of sedation. Follow-up appointments are essential to discuss your biopsy results and to monitor for any signs of complications. Watch out for symptoms like increased chest pain, shortness of breath, coughing up blood or fever, and contact your healthcare provider if these occur. Many patients can return to work and normal routines quickly after a needle biopsy, often within a day or two, as long as they avoid strenuous activities. For surgical biopsies, a more cautious approach is needed, with gradual resumption of activities over 2 weeks or more. Remember, everyone heals differently, so it's vital to follow your doctor's instructions closely. In general, recovery from a lung biopsy can take anywhere from a few days to a couple of weeks, depending on the procedure and your personal health. Always consult your healthcare team for personalized advice and to ensure a safe and smooth recovery.